Hi everyone, it's Dr. Becky, Dementia Disruptor, with tips, tricks, and potentially painful truths about dementia. Let's talk a little more about showering, because there's a lot to talk about with showering. So another thing that can cause some of our trouble and some of our trepidation of going into the shower is that visual acuity that we've talked about with other things like walking into walls and using it to our favor to not go downstairs or outside or things like that. So the challenge with this is the side of your bathtub and your bathtub are the same color. And while we might be able to see it, sometimes with that visual change, we can't tell the difference. So we can't tell if our leg's all the way in or all the way out. It becomes a fall hazard, a huge fall hazard. A lot of falls happen in the bathroom for this reason, among others. And so maybe putting some bright colored tape along just the top of the bathtub so we can see the edges a little more clearly, so we know exactly where we're putting our leg on the way in and out. Same thing with a walk-in shower. My shower has 1 inch to 2 inches of tile on each side of the silver bar where the door latches. So easy enough to miss on one side or the other, especially if our tile on the outside of the shower is a similar color. Doesn't even have to be the same color, just similar, can also make that difficult. So putting some tape there, some nice duct tape that's waterproof is helpful, just to show the edges of that. I was also looking, and sometimes it's getting our leg up enough because we also can't tell how high things need to be. So where mine has like a 4-inch step up into the shower, maybe I get a 1 or 2 inch step that I put in front of it. So we step up and in, and then down again on the way out. Again, putting tape on the edges of all of those to show where our feet need to go. So looking at all of that, thinking about those kind of things, looking at throw rugs that while they soak up all the water on the way out, they also are a trip hazard. So just keeping the bathroom safe, thinking about those visual acuities of what's going on while we're in the bathroom, making sure that where they're stepping, where they're moving is clear, and they can figure that out a little better without us going, okay, step your leg up, bring it a little more forward, bring it a little more back. Because again, that sounds like we're telling them what to do and they can't do it. All right, so give that a try. Look at your bathroom, see where we might need to do something like that, see if it works. All right, do all the things, like, follow, share, keep everybody safe, try to keep yourself sane, and have a great day.